Carpal tunnel syndrome causes multiple symptoms such as having pain, numbness, and tingling sensation in your wrist, thumb, index finger, middle finger, as well as the lateral half of the ring finger. It occurs usually after the compression of the median nerve. The median nerve passes through a tunnel at the anterior part of the wrist. Due to the nature of this tunnel, which is called carpal tunnel, particular activities that involve the wrist predisposes the median nerve to get compressed within the tunnel, causing carpal tunnel syndrome. Data proves that carpal tunnel syndrome affects millions of Americans every year, yet experts are not entirely sure of what causes it. A combination of lifestyle and genetic factors are likely to blame. There are numerous risk factors of which nearly everybody has one or more of them at some point in their lives. Carpal tunnel syndrome has no known cause. It is often as a result of a combination of factors that increase pressure on the median nerve and tendons in the carpal tunnel, rather than a problem with the nerve itself. Sometimes no single cause can be identified. People who are at risk for carpal tunnel syndrome are those who do activities or jobs that involve repetitive finger use. This includes motions such as high-force motion as occurs in hammering, long-term use, extreme wrist motions, and vibration. Many other factors that can also contribute to the development of carpal tunnel syndrome include heredity, pregnancy, wrist fracture and dislocation, wrist or hand deformity, diabetes, arthritic diseases such as rheumatoid arthritis and gout, alcoholism, tumor in the carpal tunnel, old age, and amyloid deposits. Signs and symptoms of carpal tunnel syndrome usually begin slowly and can occur anytime. Early symptoms include numbness in the hand at night, tingling and pain in the fingers, especially in the thumb, index, and middle fingers. It can also cause weakness in the hand, reducing the hand function in activities of daily living. Carpal tunnel syndrome can be diagnosed through tests and imaging. Depending on the symptoms, your doctor or therapist will examine you and perform some special tests just to confirm his suspicion. These tests will include Tunnel sign. In this test, your doctor or therapist taps over the median nerve at the wrist to see if it will produce tingling sensation in the fingers. The test is positive if patient symptoms start to show or even increase. Phelan's test, also known as wrist flexion test. In this test, the patient rests his or her elbows on a table and allows the wrist to fall forward freely. Individuals with carpal tunnel syndrome having the hand in this position will increase their symptoms. X-ray of the wrist may be requested by your doctor or therapist if there is limited wrist motion or evidence of arthritis or trauma. Electromyography and nerve conduction studies can determine the integrity of the median nerve itself and how well it controls muscle movement.
Treatment.
Treatment of carpal tunnel syndrome can be surgical and non-surgical depending on the cause and severity. Medication may also be prescribed to deal with some particular symptoms and comorbidities. In all these, education on proper positioning of the hand and limiting activities that cause or trigger carpal tunnel syndrome is paramount. Other preventive methods include sleeping with your wrist held straight, avoiding flexing and extending your wrist repeatedly, taking frequent breaks from repetitive activities that involve your hand, decreasing repetitive or strong grasping with the wrist in a flexed position, and performing conditioning and stretching exercises before and after activities. At the early stage of the condition, when symptoms are severe, the use of brace can limit excessive movement of the wrist or hand. This will help provide stability in the wrist to minimize patient symptoms that occur as a result of unnecessary movement of the hand. Your therapist will also teach you some conditioning and stretching exercise to deal with stiffness, muscle tension, and pain. Other manual therapies such as massage and myofascial release techniques applied at the wrist are also essential to improve patient symptoms.